Vagus nerve stimulation uses an implantable device that reduces seizures in individuals who have not had effective control with therapy. It is currently indicated as adjunctive therapy in patients 12 years and older with partial onset seizures with or without secondary generalization who are refractory to antigens epileptic drugs. A programmable signal generator is implanted subcutaneously in the chest. Electrodes tunneled underneath the skin deliver electrical impulses to the left vagus nerve, cranial nerve 10. No longer adverse effects have been reported with VNS, but dysphonia, throat or neck pain, and cough can occur during stimulation. Surgical therapy. When seizures are caused by hematoma, tumor, or other cerebral lesions, surgical removal is the treatment. Is reserved for children who suffer from incapacitating refractory seizures. Refractory seizures are usually defined as the persistence of seizures despite adequate trials of 3 anti-epileptic medications alone or in combination. There are several types of surgical interventions. Focal resection entails removal of the epileptogenic zone. Hemispherectomy involves removing all or most of one hemisphere in patient with catastrophic hemispheric epilepsy. Corpus callosotomy is a surgical procedure that involves the separation of the connections between the two hemispheres of the brain and is used in some generalized seizures. Status epilepticus is a continuous seizures that lasts more than 30 minutes or a series of seizures from which the child does not regain a pre-morbid level of consciousness. The initial treatment is directed towards support and maintenance of vital functions. ABCs of life support, administration of oxygen, gaining IV access, and immediately followed by IV administration of anti-epileptic agents. Buccal or intranasal midazolam and rectal diazepam are simple, effective, and safe treatment for home or pre-hospital management. Cessation of the seizures occurs in 8 minutes with buccal and 15 minutes with rectal diazepam. Rectal diazepam is not associated with respiratory depression when used as recommended. Intranasal midazolam not only is safe and effective for stopping seizures but also is easier to administer than rectal diazepam. For in-hospital management of status epilepticus, IV diazepam or lorazepam or Activan is the first-line drug of choice. Lorazepam is the preferred agent because of its rapid onset 2 to 5 minutes and half-life 12 to 24 hours with side effects. If ineffective, phenytoin or phosphenitoin followed by phenobarbital is given as the next line of treatment. Nursing care of a child with epilepticus. The child must be closely monitoring during administration to detect early alterations in vital signs that may indicate impending respiratory depression. Addition to the ABCs of life support, monitoring blood pressure, and body temperature. Prognosis. Most children who experience a second seizures will experience additional seizures. Epidemiologic studies using population or community-based cohorts show that the etiology and specific epilepsy syndromes are the most important factors affecting prognosis. Children who have cognitive impairments, or cerebral palsy are at the high risk of developing epilepsy. Seizures remit in more than two-thirds of children with childhood onset of seizures. Mortality is increased twofold in children with epilepsy, those with neurologic abnormalities or seizures that are refractory to treatment at the high risk. Intractable epilepsy and status epilepticus are convincingly related to serious morbidity and mortality and often associated with severe neurologic abnormality or concurrent serious illness or infection. Intractable seizures are failure to control seizures after two appropriately selected anti-epileptic medications are trialed. Intractable patients have higher risk of premature death, injuries, psychosocial dysfunction, and poor quality of life. Seizures duration for 1 hour or more associated with status epilepticus is associated with significant morbidity and mortality. Nursing care management. An important nursing responsibility is to observe the seizures episode and accurately document the events. Record and note any alterations in behavior preceding the seizures and the characteristic of the episode, such as sensory hallucination phenomena, motor effects, alteration in consciousness, and prostactal state. The child must be protected from injury during the seizures. Placing the child on the side facilitates drainage and help maintain patent airway occlusion. Sanctioning of oral cavity and posterior oropharynx may be necessary. Take the vital sign and allow child to rest if at school or away from home. Long-term care. Care of the child with epilepsy involves physical care and instructions regarding the importance of the drug therapy and probably more significant, the problems related to emotional aspects of disorders. Nursing care is directed toward educating the child and family about epilepsy and helping them develop strategies to cope with the psychological and sociological problems related to epilepsy. Children with epilepsy are prescribed anti-epileptic medications which are administered at regular intervals to maintain adequate levels in the blood. The most convenient times for administration seem to be with meals or at bedtimes. In general, anti-epileptic medications are continued until the child has been seizures-free for 2 years. Educate the child and parents about the possible adverse reactions to the medications used to treat seizures. Children are encouraged to engage in most normal activities. Participation in competitive sports is determined on an individual